Okay, well, I'll just go ahead and get started. So again, for those of you who are joining us and listening, this presentation is about my practice, AspireMD, a direct primary care practice, and particularly about how it's a needed healthcare benefit for employees and employers to kind of offer their employees. So today you will hear from myself. So I'm Dr. Ascanio. I'm the owner and physician at AspireMD. And then Lou Ascanio, same last name, that's my dad. He is an employee benefits consultant and has a little bit more knowledge around the healthcare piece and the health insurance piece, and then also how it can help employees because he's been in the benefits field for a while. So that's us. Our agenda today, if you're curious about what's to come, going to take a little bit of time to talk about just healthcare and health insurance in general, kind of pre and post COVID, because stuff has changed a little bit. The benefit of employee benefits. So of course we know what employee benefits do for the employee, but how can that also help employers? And then kind of talk a little bit about primary care in the US and tie that into what I'm doing with my practice at AspireMD, and then kind of finish out with how employers can actually sponsor AspireMD for their employees. And then Q&A at the end. If you have any questions throughout this, again, just go ahead and use the chat function or the Q&A function, and we'll kind of see that and hopefully get all your questions answered. So we'll start with Lou. He's going to talk a little bit about, again, healthcare and health insurance.
Thanks, Nicole. So I do feel that the title of this slide is a little aspirational. We're not quite over our COVID-19 pandemic experience, but we'll be optimistic and at least believe that we're on the downhill side of things. And first, talk a little bit about what's the same. Obviously, we know a lot has changed. We'll talk a little bit about that. But in terms of things that really haven't changed, we're still under the Affordable Health Care Act regulations and umbrella of legislation, and really hasn't affected, there hasn't been any changes that really have changed the employer-employee side of things. Still, employers that have over 50 employees are required to offer a healthcare plan to employees, and companies that are under 50 employees, it's optional. Really where you've seen the biggest change due to COVID in terms of ACA has been a loosening of the open enrollment rules for people who join the individual plans through the marketplace, as well as some things that have made it more affordable for folks to join. Unfortunately, as it was the case pre-COVID-19, we're seeing healthcare costs and health insurance costs rising, and again, similar to pre-pandemic, a lot of that is driven by prescription drug costs going up and up and up. In part, certainly because some miraculous prescription drugs are being introduced to the marketplace that are really saving lives and doing wonderful things, but in some cases costing literally six figures for a dose. And large claims, over $1 million used to be rarer. And now are becoming more and more frequent. What also hasn't changed is employees' value benefits, and we'll talk more about that. But what also hasn't changed and is a reaction, obviously, to rising healthcare costs and health insurance costs is the fact that employers are having to shift risk to employees. That was a trend that really began, let's say, post 2008, 2009 recession, and it has accelerated to some extent. And a continuing focus we see on behavioral health and chronic care types of conditions, because those also drive considerable costs. So those are the things that have kind of remained the same in this environment. What's changing to some extent is the fact that this pandemic has affected companies in so many different ways. I mean, some, like let's say Amazon, have thrived and grown during this period of time, where others have literally, gone bankrupt. They had to shut their doors. So very uneven recovery. And companies obviously are having to deal with this in different ways. Some are expanding their employee benefit programs, and some are paring things to the bone just to stay alive. And that's certainly understandable, and we'll see that continue, I think. Certainly, we've changed the way we've kind of done the office thing, and that will likely continue. A lot of work from home continues, but now we're starting to see hybrid scenarios. My son works for a large technology company, and he's just been offered the ability to return to the office either on a hybrid type of schedule, several days in office, several days at home, or completely back in office. So we'll continue to see those. Certainly, virtual care utilization is on the rise. I've seen some things saying that it was accelerating pre-COVID, but the pandemic probably accelerated the virtual healthcare revolution, let's call it. And specifically, I'm talking about getting your healthcare via text or video or phone call, as opposed to face-to-face. Accelerated that trend by at least 5 years or so. And the drivers there obviously were people not wanting to go to the office initially, but there's certainly economic drivers to that as well. We're certainly seeing people in general be more focused on their healthcare through this. This really made this pandemic has made people's health kind of foremost in their minds, and employees focus on their own health, their healthcare, their health insurance has increased. We are seeing a continuing acceleration of high deductible health plans, and the move into high deductible health plans. Affordability is a big part of that. And I'll tell you, that plays directly into this conversation that Nicole's going to have around why it's so important to have your primary care, kind of a good plan for it, let's say. And then finally, for those employers who certainly have the wherewithal, we're seeing them add benefits. Now, some of those benefits may be what are called voluntary benefits, so employee-paid benefits. Don't add cost to the employer necessarily, and also resources. A lot of resources around, like I mentioned, behavioral health types of things, and such things as just overall well-being, some financial well-being. There's just been kind of an explosion in that employee benefit arena, and again, with it playing out very differently across different companies depending upon their financial situation. So the last thing I would address is, where do employee benefits stand in terms of employee affinity? Do they actually, help employers attract, retain, and engage employees? And the statistics, as you can see, are pretty compelling that they do. And if anything, through this pandemic, it's made employees' appreciation and focus on their employee benefit plans all that more important, with health care and health insurance being the primary, but not only focus in that regard. And certainly understand that a lot of folks who are probably listening to this today are in that group of employees with less than 50 employees who may not be offering a health plan at all. And the good news here is, as Nicole will explain, is this AspireMD option is really generally available regardless of size and regardless of budget. So I don't want to steal Nicole's thunder with regard to that piece. So Nicole, I'll hand it back to you.
All right, thank you. Thanks for that kind of overview of the insurance and then also employee benefits. So kind of when I talk through primary care and then direct primary care and my practice, AspireMD, I guess I would just say continue to think and circle back to how this affects the end person in this situation would be either you as the employer or your employees, and what they gain from this. So this is kind of just a general overview of the state of primary care in the United States right now. So kind of like, what is primary care? Well, it's really the backbone of someone's health coverage. Primary care physicians are accountable and responsible for addressing really the majority of a person's healthcare needs. And we kind of cover everything from preventative medicine to chronic disease management, and treatments, and then referrals, all that kind of stuff, while also maintaining a sustained relationship with patients in the community. So it's kind of a big overarching part of your healthcare, and really should encompass the majority of what you seek out a provider for. And the quality and comprehensive primary care that is, most ideal, really can make or break someone's health outcomes if it's not optimal. So the problem is access to primary care really is declining. So you see there declined 11% from 2005 to 2015. And that's because of a few different things. I mean, one is the growing population. So there's more people, more people out there, which means more primary care physicians are needed, and people aren't going into primary care as much as they used to. It's not as much of a desirable field for a bunch of different reasons, but that leaves us with kind of a shortage. So more people, fewer primary care docs, and what are you kind of left with? Part of that then also translates into just fewer adults having a primary care doctor. A lot of people kind of will say like, oh, well, I see my dermatologist and I see my heart doctor, and that's it. And then, from our end, it's like, well, what about everything else about you? What about the rest of your preventative care? So it's not ideal to only have, specialists or not have a regular primary care doctor. There's also, the growing demands that are placed on the primary care physician. One, that demand kind of tells you that there's a large patient panel per doc. So the average doc has about 2,500 patients beneath them that they're the primary care provider for, and working, 4 or 5 days a week. That usually translates to seeing anywhere from 20 to 30 plus patients per day. And that right there, in addition to pressures from insurance companies and hospital systems to make certain marks and do things a certain way, has unfortunately really diluted down the quality of primary care as a whole. You can imagine, with an average of 10 minutes per visit. And honestly, sometimes that's as low as 5 minutes of face-to-face time with your doctor in these kind of settings. That doesn't give you a lot of opportunity for quality outcomes, because in primary care, minimal time spent with the patient really translates to poorer quality. So that all sounds really grim. But what's the upside? Well, direct primary care is kind of like a solution for both patients and physicians to this problem. Patients, of course, want someone who can listen to them and knows them and can help them answer their questions. And physicians really want to be able to spend time with their patients. So direct primary care, that's kind of where I come in here with my practice, AspireMD. It's a direct primary care practice, which for those of you who aren't familiar with that, it's kind of like an innovative alternative payment model without any third-party billing. It kind of dramatically improves access to high quality primary care, not just your kind of general primary care that we talked about with 20 to 30 patients a day, but I'm talking about real, true, comprehensive, whole person, personalized care. So what I feel like, we're giving at AspireMD is an unmatched doctor-patient experience. What you're not able to get, outside of this setting, I think you'll be able to kind of contrast it by realizing that when I see patients, I spend anywhere from 20 minutes to 90 minutes, depending on what the patient needs, what they need to get out of the visit, how long it takes me to help, address their problems or listen to what's going on. Of course, we can do quick things like come in, I think I have a cold. Do I need something? Yeah, I'm not going to take up, 90 minutes of your time. But if you have a lot of other things that need to be addressed, I'm there and we can talk. I'm not rushing you out. You're not getting told you need to schedule another appointment. There's no corporate healthcare profit requirements. There's no insurance company interference, which means I can kind of take care of patients as I see fit, which has been really, really important in feeling like, we're able to really provide this convenient and comprehensive benefit to patients, which is what true primary care, really should be. I feel like I really know my patients now. I did not know them when I was in kind of a corporate setting. You just can't. It's kind of like a revolving door. I really am a firm believer in comprehensive, personalized, whole person primary care. When you are under the constraints, of the more corporate setting, the quality of care is sacrificed. And at AspireMD, my goal is simply to do what's best for the individual patient. Another huge benefit is flexible scheduling, fast access in person or by text, email, phone, however it works for the patient. I'm a busy wife, mom, doctor, and to be able to just, text a question to your doctor and have the answer addressed, or figure out, hey, do I need to come in for this? Can we take care of this over video? You don't have to necessarily take time off of work. The patient doesn't have to get a babysitter to watch their kids or, interrupt their whole life just to continue with good health care. So when my patients have a concern, they just text me and usually can get a response back within the hour. It's funny, I just had a patient who was helping her son with a science project, and she texted me through our app and asked if I could fact check a couple of things for her. And I'm definitely not advertising myself as a science tutor, but I was more than happy to help answer her a couple of questions. And she was like, oh, you're a lifesaver. We've been agonizing over this, for the last couple of hours. So simple things like that. I can't even imagine that question probably wouldn't even get brought back to the doctor, in a different setting. So by, and how can I continue to do this? Well, keep your patient panel smaller. We probably hit capacity around 400 patients. And that way we are able to kind of continue to provide this type of care. And your care is really never watered down. The other thing we can offer, The other thing we can offer at AspireMD is wholesale medications, wholesale lab pricing, and this is a big one because it allows us to significantly expand diagnostic capabilities and include advanced lab work at every physical. So instead of just every patient kind of being the same, able to really personalize things and give more advanced care. We also offer health coaching. So for those patients who need a little bit of extra help, either defining their goals or meeting their goals, that's another thing that we work with just to, again, keep the patient overall health, wellness optimal. And that includes mental health too. So that's a big thing of what we do with primary care. That's a big thing that can impact someone's productivity in the workplace. So aside from just, keeping them healthy and in the office or able to be productive, we also can help take care of their mental health. And this kind of ultimately at the end of the day, we just have better outcomes with our patients. So fewer hospitalizations, fewer specialty visits. They're not having to go to the urgent care or emergency room after hours, because usually it can just be taken care of over, a phone call. And then ultimately, people are saving money. So yes, it's kind of like an additional thing that people are paying for or employer is paying for, but at the end of the day, it actually does end up saving everybody money. So then back to kind of like the employer-employee part. This is going to, again, like I said, save the employer and employee money, reduce absenteeism and offer convenience for the employee. Improved healthcare leads to improved productivity. And then also, I know that when I've worked at other jobs in the past, the employee benefit piece and the different things that were offered to me really did help define how valued I felt at that company. So providing something that you know is going to dramatically help your employees stay healthy, and help provide them with convenience, really does translate to them feeling more valued within the company, which then helps with retention. It also helps with recruitment, because again, that's something that people will look at when they sit down, which job do I want to take? Here's the pay, here are the benefits, it just kind of goes hand in hand. And then offering direct primary care with AspireMD, it's just a practical way to promote your business kind of wellness-oriented culture, because we're all headed in that direction. You want to prevent burnout, you want to make sure people feel valued, and it offers, a nice commitment to your employees. So, how then do we implement this, for your company, for your business, small business? How do we help? How can you sponsor direct primary care and AspireMD for your employees? The nice thing about this is it's completely flexible. So it's not a opt all in or all out. What we have are discounted group rates for employers to take advantage of, and you can do completely employer funded, you can do completely employee funded at that discounted group rate, or you could do a mix of the two. And then this is compatible with current health plan offerings. Let's say there's a business that already offers a health plan. This goes kind of side by side with it, because a lot of those health plans are the high deductible plan, which we would try as the primary care office to take care of 80 to 90% of the healthcare needs, so that the patient's not having to put things towards the deductible unless something big happens. You can also offer this without another healthcare plan offering, because a lot of small businesses don't have the ability to go with a full health plan, and employees are kind of on their own from that respect. But this is a way to really get them, honestly, 80 to 90% of their healthcare needs at a really affordable cost. The payroll deduction piece is completely optional, so it can be used or not used. Again, that just kind of goes towards the flexibility of everything. Because a lot of people may be thinking to themselves right now, I've never heard of direct primary care before now. I haven't heard of this, AspireMD in the practice, and that might be overwhelming at first, but we provide, tons of communication and education to the employer and the employees. That's really a key, to help the employee understand this is what you should take advantage of. This is how you take advantage of it. We help from the employer side to implement everything, make it really easy. And the digital communications and on-site meetings, it's just kind of standard for us. And then again, the employees can opt in or opt out at any time. So it's different than that, like once a year enrollment where you change your benefits. With us, you can opt in or opt out anytime you want to throughout the year. So just a couple different, ways that we're able to be really flexible with everybody. So that's kind of like a big overview of primary care in the United States, and then what direct primary care is and what AspireMD is able to offer, and then how it can also help employees, and employers. So right now, I'm gonna kind of answer any questions that might have come up. And again, if you think of any questions later, please feel free. You see our information there. So our website, phone number, and email. Happy to take questions at any time. There's definitely a lot of questions that have come our way in the past. For example, why offer direct primary care when I already have a health plan in place for my employees? And I kind of touched on that a little bit, but first I would say a lot of small businesses don't offer or aren't able to offer a specific health plan. And this way we're able to kind of give them a huge addition to their kind of healthcare arsenal without the business having to kind of buy into a full health plan. But those who do offer a health plan, it's just like what kind of we talked about before. Instead of just sticking with that diluted primary care that really isn't high quality and really isn't convenient for the employee, you can supplement it with the AspireMD, where you're able to get the convenience and the quality care kind of all at an affordable price. Some people will ask, well, can an employee continue their care, after if they were to leave the job? And of course, as opposed to them kind of leaving the job or moving on and losing all of their care, they're more than welcome to continue on with me, and because it's just a direct payment kind of thing. And then families, that's another big one. Some benefits are just for the employee to take advantage of, like health coaching or therapy, that sort of thing. But with this, if the employee really enjoys it, thinks it's a great offering, then yeah, their whole family can sign up, and we can do that through our otherwise discounted family rates. So there's a lot of different ways to go about doing this and help the employee, help the employee's family, and then ultimately help the employer and their business as a whole. So I think that's probably about it. Let me see, just make sure. Again, there is our information there. We're happy to kind of talk through anything, even just a meet and greet if you want to have a little bit more one-on-one time to talk this through about your business. But otherwise, thank you to everybody for coming and listening, and we look forward to hearing from you.